altruistic to something for profit, which again opens the door to great exploitation of people who simply need income. Now, unlike sperm donation...
Could you come to the point, please?
Not the parallel. Where's the jump between egg donor, which is egg donation for profit, which is legal, and any other organ donation for profit?
The question, what is the ethical jump between selling an egg, which is legal in the United States, widely advertised, performed at the best New York hospitals, and selling a kidney?
I don't see any distinction. That's why I am for paying. I want it to be regulated, and I want to avoid the situation today where it is very hypocritically prohibited, but everyone knows that it's being done, and it's done in a bad way, and I would prefer it to be done in a right way.
I want to get two more questions. Amy, you want to comment?
As far as I'm concerned, the distinction is that there is a law in the United States that tissue organ donation is illegal. I agree that it should be changed.
Hold it, last two, please.
If you would agree that being brain dead is halakhically alive, and then you have, let's say, a surgeon doing donation, do they have a ability to figure out if the patient is Jewish, in which case, or even if not, which case, and then not do the surgery?
There were three questions. Question one, is being brain dead being halachic?
Debatable.
No, that's not an answer.
What do you mean? There's one position who says that they are alive. My person is that it's dead.
Thank you. And the second part of your question?
Well, I would disagree with that, and you would say, oh, it's alive.
But he didn't.
No, she talks about a patient.
No, but she's saying you disagree.
You disagree with that. Is it not halakhically acceptable, that opinion, to do the organ donation?
No, that's killing the person.
Last question.
I just want to say that anybody who says that you should not sell your kidneys, first go to India, first go to Bangladesh, first go to the Philippines, and meet those people and speak to them before you say that it's unethical to sell your kidneys. Because I know for a fact that they absolutely will. And saying that you wouldn't is just ignorant, because it just means that you haven't seen the culture. I'm
asking you to summarize and close, but first I want to do one more from the audience where Dr. Steinberg and I differ, and he's a I'm going to make the flat-out statement, and you can agree or under no circumstance, no matter who, why, pressures are, is it ethical, in my opinion, to take a child. Okay? That's as strong a statement as you can make. Yes, I agree, or no, I disagree. Yes, I agree. Please raise your hand.
We have to know the conditions.
No conditions. I said there are no conditions in which you can take an organ from a child, for another person. Yes. 1, 2.
10-year-old.
Yes, I agree. 1, 2, 3, 4, 5. No, I disagree. Okay, you're in the majority. Thank you. And I'm right. I wouldn't have the courage to argue with you. We'll have reverse order of the original presentation, starting with Dr. Steinberg.
Well, I think that we touched the issue. There are so many issues that we didn't discuss at all, and some were very briefly discussed. But I think the bottom line is that we should remember that organ donation is a life-saving procedure, and what is possible to do in order to increase the number of organs available should be done, obviously within and laws that are in particular areas.
Thank you. Dr. Amy Friedman, Yale University.
So long as societies continue to be based on people who are willing to accept but not give, we will have systems that are not able to satisfy the great need. That does not mean that we can overlook the great need to protect organ donors and worry about their safety. And as a surgeon, I am not willing under any circumstances to compromise with my hands the safety of donors under any circumstances, particularly children.
My closing comment would be one with which the panel concurs, and that is a message for all of you to go home with. Mean age, average age of new patients with kidney failure in the United States is 64 and a half years old. We are coming into management being geriatric. From Amy, from Dr. Steinberg, and with my concurrence, you have heard that giving a kidney to an old person is a reasonable thing to do, and that age is not a criterion for the selection when a deceased donor kidney becomes available. Whether we live and practice that rule or just expound it will be seen in the years ahead. But we're treating old people, and we're going to continue to treat them, and it's something we have to come to terms with. On behalf of the Society, I thank Dr. Steinberg and Dr. Amy Friedman. Thank you.